Hi, I'm Leslie Davis, and I'm joining you from San Diego today at the CARPS conference. I'm a nurse practitioner, also a nurse scientist, and I just got through doing a talk on one of my favorite topics that I'm passionate about, women and heart disease. And if I had to give you 3 takeaways from the talk, the first one would be that women, we know that they aren't all going to have chest pain when they have a heart attack, or acute coronary syndrome as we call it. But the most important thing is about half the women are going to have very typical quote-unquote symptoms, and very classic, about maybe 2/3 would have chest pain, but it would really declare itself, acute onset, maybe high severity or intensity, but we know about those. But there's another half of women that have really intermittent, low-level symptoms that are able to continue working, caring for kids, caring for grandkids, and they and providers may have a false sense of security that it's probably not their heart, or they wouldn't have been able to continue doing their activities. But in fact, the women and the providers need to know that there's a group of women, a percentage of women, that have those very low-level intermittent symptoms where a heart attack may take hours or days to declare itself. So we need to not equate symptom severity or continuous duration with that's the only way to have a heart attack. All right, secondly, when they have a heart attack, and I teach women that have had an acute coronary syndrome event, 1 out of 5 will have another event in the next year. Now sometimes that really sort of takes the floor out of a patient. They've come into the hospital, they're not having symptoms, they feel like it's been fixed, quote unquote, with an angioplasty or stent or medications. But 1 out of 5, 20% will have another event in the next year. So we need to empower them of how to monitor and watch for symptoms, and how to know how to do self-care, which means, you know, decrease risk factors, but also know when the symptoms occur. Now most symptoms might go away after 5 minutes of rest or 1 nitroglycerin, but keeping up and connecting the dots of, does that happen once a month, or is that now happening once a week? And connect the dots when the symptoms start coming back, if and when, and to really pick up on it before it turns into a heart attack. So to empower them that sometimes when a symptom pattern develops, they can go into their provider and sometimes get a non-invasive test or adjust their medications and prevent that second heart attack. Now, if they were to have any symptoms that 1 nitroglycerin doesn't take care of it, we all used to think, okay, after 3 nitro, call 911. Well, the guidelines in the past maybe 5 or 10 years actually changed that if you have a history of heart attack or an ACS event, after 1 nitro, if the symptoms continue after 5 minutes, you need to call 911. Now there are some cardiologists that stick with the traditional 3 nitroglycerin rule, but the guidelines actually say after 1 nitro you call 911. What we know is only 40% of the people worldwide actually use an ambulance to go to the hospital, and that's even in countries where it's free of charge. And patients and providers think, oh, you take an ambulance because it will get you there faster. That's not the take-home message for our patients. What we need to teach them is that ambulance, in many cases, they can do a pre-hospital 12-lead EKG. And if they're the 20% that heart attack declares itself on an EKG by an ST segment elevation MI, they can have that cath lab ready and waiting to open that vessel and stop that heart attack. They also can administer life-saving intervention with oxygen if needed, but nitroglycerin, and have the IVs in, and actually have the defibrillators if they're the 10 or 15% that go into ventricular fibrillation. So really push the issue that calling the ambulance, even providers and patients can't get this false sense of security, oh, the pain's only 2 out of 10, or it's intermittent. If they believe it's heart-related symptoms, especially with a history of an ACS event, they need to call 911. Not just because it may be faster, and in fact sometimes it's not faster, but because they can do an EKG and have the cath lab ready. So that's all from San Diego.